So, welcome back. In ancient Egyptian history, the bodies that were mummified would always have the heart and the kidneys left in them because the kidneys were considered as important as the heart, which they are because they do so many things for our body. But the two most crucial things they do is they maintain homeostasis. Remember that perfect balance of salt, sugar, etc. So all the enzymes in our body can work, such as the ones that are the smallest ones in the cells, the tissues, the structures, and the organs, and even the arteries that are connecting the whole system. And then number two, they filter the body of all the toxins that are building up over time. Because of this, the kidneys are very, very fragile. So imagine, if you will, a lace handkerchief. And if you take that handkerchief and you crumple it up into a ball and you make it the size of your fist, that's your kidney. And you have two of them right below the rib cage near the back. And because the kidneys are so complex, they really have to protect themselves first when anything happens in the body. So one of the things they will do is they will control the amount of blood or blood pressure being thrown at them. So if a patient develops hypertension and now there's this raging river of blood coming to them, the kidneys will actually clamp down the arteries that are supplying them with this blood in a hope to limit the damage. The body notices. So the body says, wait a minute, homeostasis is off. The toxins are building up. So now the body will send signals to the heart to pump harder. So now the heart gets thicker, the arteries get stiffer, and the kidney gets more irritated, and this cycle just continues. Now add to this diabetes, which we already learned about, in that it damages the smallest arteries and the tissues around it. So now the diabetes or the high sugar is damaging the kidney tissue itself. So it's not doing 100% of what it should be doing, and that is now hanging on to too much salt and too much water instead of urinating it out. This in turn will drive up the blood pressure, make it worse, and then again add to this cycle. Which is why you often hear that a lot of diabetics will get started on a blood pressure pill, even though they don't have hypertension, and is done to protect the kidneys, which hopefully makes better sense now. As Mr. Spock would say, logic is the beginning of wisdom, not the end. Until next time.